I'm just going to speak very briefly about why I'm representing the Leg Club Foundation as a trustee here, and I just wanted to speak briefly about why the Foundation believes that well-being is an important issue to support and to debate and to discuss. And as you may have noticed, it's been a very strong focus of what we've been speaking about over the last 2 days. And I think there's a very good reason for that, and I just wanted to explain why that is. This is the Clinicians, I hope I pronounced it okay, Leg Club. That I don't know if Len was here, who came and picked up the Volunteer of the Year award yesterday, but I was delighted to hear that Clinicians had won that. It's a lovely place, like most other leg clubs are. I was there in August 2012, on a beautiful sunny day, and the Leg Club was just underneath the valleys. Interestingly enough, every single volunteer had read 50 Shades of Grey, I found out. And I don't really understand why that's the case, and I'm guessing that volunteers from all the other leg clubs may well have read 50 Shades of Grey. Whether it's done anything for your well-being, I don't know, but I just found it interesting. I think even the dog over there had read 50 Shades of Grey. But you just needed to walk in and have a look at the place and really understand instinctively, without knowing for any facts, that this is a place that helps people's well-being and helps to increase people's well-being. You just have to walk around the place as opposed to a hospital clinic, in my opinion. What we have to do is figure a way to prove that. And that's why we think this is important. And I'll come back to that in a minute. So a lot of work has been done quite recently by different groups. One group that Trudy and Mike have been involved in, which is developing a consensus of well-being in wound care. And they come up, obviously, with this statement that the impact of living with a wound is complex and multifactorial. You all know that. Clinicians, industry, and healthcare organizations have to often focus on wound healing as a key outcome measure. Healing as an outcome measure, I think we all know, is not enough, even though it's extremely important. That comes from the international consensus, which was published last year on well-being. Living with a disease is something that, unfortunately, we are all going to have to do at some point in our lives. We are all going to succumb to disease. Optimistic note, I'm afraid. But with wound care and with any type of disease, isolation, low self-esteem, depression and fear, they go hand in hand with disease states, and it's going to happen to all of us. So healthcare has to be about a lot more than about just healing. Well-being, we've had lots of discussions about that. There's lots of definitions going around. The one that Dominic and Penny quoted in their review, which they've just completed, is referring to the presence of positive emotions or satisfaction and the absence of long-lasting and persistent negative emotions. And obviously it's that we want to promote as far as we possibly can. The Leg Club philosophy has always been to promote well-being in one way or another. The whole idea of a social model of care is one that is based on interacting with people, as Dr. Foster said, people who are in their care, and that's why they're called members and not necessarily patients. And I think that's a very important difference that the Leg Club has, as other organizations that are patient-focused in this way. And we, the Leg Club Foundation, has actually undertaken as a group a large amount of research over the last couple of years. Some of it which has been out in the public domain and some of it which is not yet completed yet. That's why many volunteers and many of you have had to do a lot of paperwork on a weekly basis so that we can actually analyze what's going on with the people who are going through the Leg Clubs. So there's research going on wound treatment and wound outcomes, on well leg treatment and outcomes for people who actually have healed wounds, on the effectiveness of different therapeutic options, including alternative ones like, acupuncture or hypnotherapy, maybe. Patient satisfaction, which we came back from, was it 2 or 3 Leg Clubs with very positive answers, 5 Leg Clubs, which came up with dramatically positive answers. So we know that patients are very satisfied with going through the Leg Club system. But importantly, well-being is the next one that we really want to work on as a group. And how are we going to do this? Well, we have actually started very much thanks to a grant that we've been given by the Ergo Foundation at the end of last year to do some work on this. In conjunction with the University of Worcester, Dominic and Penny, and the research assistant, Abby Andrews, we've already conducted a full literature review on well-being in relation to leg ulcers. We did it for a reason, not just to publish for its own sake, but to actually provide the intellectual basis for providing a model that can assess well-being in typical leg club members. This has actually been piloted as a pilot draft questionnaire that many of you are probably going to see, so that we can develop a fully structured, quite brief questionnaire that we can actually find out from people what their specific well-being is. And of course, that's not a quality of life questionnaire, it's a well-being questionnaire that's been specially devised. We've written up and have submitted the results for publication, which ought to be certainly before the end of this year, we hope in 2 journals, so that we will have the kind of backing that's going to prove that we've been working on this and we're coming up with something structured and meaningful. So thanks to Professor Upshon and Penny on that. We've almost completed that phase, and what we want to do next is a second, much more detailed phase. And I'll just outline very quickly what that is. We want to develop and test the questionnaire that's been devised with 150 leg club members as a kind of initial pilot. We hope that this will generate well-being scores that we can then analyse. We're still working on how those scores are going to be, but we think that this is going to be possible so that we can say that somebody's well-being is at a certain level. We will review the questionnaire and reevaluate these scores after a given period of time, which means basically we're going to go back and work with the same members again after 3 or 4 months and assess initially whether there's been any difference in these scores. So there may be people who've recently joined the leg clubs whom we then interview again after 4 months. So it may be people who are actually undergoing regular treatment. That's going to be devised in sort of a sort of scientific basis by the University of Worcester. That will start to give us an impression of the contribution of Lindsay Leg Clubs to the well-being of members. And we're going to write up and publish the results. Ultimately, of course, the aim is to expand this process throughout the whole leg club network so that we have a very precise and very specific way of analysing and demonstrating that the leg clubs have some impact on member-patient well-being. So why are we doing this? Well, I've just mentioned why we're doing this. Really, the objective is to demonstrate categorically that Lindsay Leg Clubs can improve the well-being of their members. If we can do that, then I think we're laughing in terms of highlighting the benefits of the leg club system to commissioners, to clinicians, to the community at last. And of course, I think we're going to be providing a serious benefit to members and patients. This will be published, so it will be in the public domain. So even wider than the leg club story itself, there's going to be some demonstration in the whole wide world that you can create well-being scores. They can be hopefully transferred to other disease areas, and it's going to be an interesting new way to measure how patients are benefiting personally and psychologically from specific kinds of treatments. So it's an ambitious plan, but it's one that we're really hoping to do, and that's why well-being is important for us. So when we go back to our leg clubs and have a chat with the dog about 50 Shades of Grey, we will be able to actually demonstrate and prove the amount of well-being that is impacting on members and patients by the leg club system. So we're very excited about this. So I just wanted to thank, because we've actually completed formally the first part of this project, I wanted to thank Dominic Upton, Penny Upton and Abby Andrews from the University of Worcester, without whom this would have not been possible. I want to thank the Ergo Foundation for really starting us off in a really positive way. I want to thank all the leg clubs for the wonderful work they do, and I'd like to thank Rob and Morag for their talks. Thank you very much.